Well, welcome back. We've had a lot of interesting things that we've talked about in abnormal psychology. Today we're going to be talking about cognitive disorders. So once again, we talked about this a little bit, of course, in Psychology 101. But whenever you hear cognitive, you think the mind. So we're going to go over some of the cognitive disorders in abnormal psychology. So cognitive disorders can be caused by a lot of things. When the brain is damaged, okay, and the effects are irreversible, okay. When the brain is damaged and the effects are irreversible, then we have cognitive disorders. Cognitive disorders develop much later than mental retardation and other learning disorders, which are believed to be present at birth. So what it's saying is that cognitive disorders that we're going to talk about occur, these are not things you're born with. These are things that occur in life, okay? We're going to talk about dementia, we're going to talk about delirium, we're going to talk about amnesia, we're going to talk about Alzheimer's, okay? So once again, cognitive disorders are not at birth. They happen and develop later on after learning disabilities, after different things. So sometimes these are associated with older people. However, it could be younger people as well. But it's something that's happened in life that's caused this to happen. Is it genetic or is it environment? Well, you know the answer to this. It's somewhere in the middle of two. Okay, we're learning the causes, and it's going to be kind of interesting. We're going to talk about a few developments in these orders. Whenever I have this, it's actually kind of a short bit of information. It's not hard. It's pretty easy for the most part, but it's really interesting. And the reason why people like studying this is because they're like, everybody's interested in this because they have seen people have some of these different disorders, and maybe even their parents or their grandparents or somebody they know, and they're like, wow, how can I avoid getting into these situations? So basically three different types here. The first one is delirium, okay? D-E-L-I-R-I-U-M, okay? It's the first type of cognitive disorder. Now, the description, okay, for delirium, okay, is impaired consciousness, impaired consciousness for hours or days, confusion, disorientation, inability to focus, and it's usually among older adults. Oftentimes, now I will tell you this kind of an interesting thing. We talk about this. The book stresses this too. One of the situations to where we find cognitive disorders happen a little quicker than older, like for delirium, it says especially with AIDS patients. And what happens is AIDS goes in and attacks the immune system, but this immune system is tied into a total neurological deal between the brain and trying to fight off disease and blood and different things. So it's actually a problem in AIDS patients that develop. AIDS patients who have had AIDS for a while, delirium is a real serious issue. Now, it says causes, okay, so due to general medical conditions, okay, or they could be substance induced, okay, and it also, when we talk about substance induced delirium, what is delirium? Once again, it's impaired consciousness. It's a period of time where we're not in charge of our senses, okay? Our consciousness, our being in charge of all of our thoughts and all of our own, what we're doing, okay, is not there. And so it's an inability to not only just focus, but to be able to function for a while, okay? So it could be substance induced, we really do a lot of crazy things to our bodies, but substances that we take in, especially illegal drug substances, and some drug substances that are trying to do something might cause delirium, okay? We even say a lot of times with certain drugs cause us to be drowsy, but we also have certain drugs that may cause delirium, wow, which means our mind to not be able to focus well, that we're not totally in charge of what we have. So what's the treatment for delirium? Okay. Pharmacology, I'm going to give you my, once again now pharmacy is what, I have a chemistry degree, and then I went on into pharmacy school. So a lot of times I throw in the pharmacy part without trying to chase a rabbit here, okay? But especially in abnormal psychology, we have antipsychotic drugs, okay? Now what an antipsychotic drug does is it tries to block, okay, the brain, all right, so that it doesn't go through this pathway, all right, or it doesn't go through this, the basic system to where we use associations with activities. So antipsychotic, we might control the brain to where we try to bypass some of the synapses. Now, there's a lot more to it than that, and I need to be careful of just introducing the pharmacology in just small amounts, but there's lots of things there. So we have antipsychotic drugs, okay, and then the psychosocial, the treatment is reassurance. We encourage the person that they're going to be okay. We have the presence of personal objects. Now this is big. Okay, so once again, what's the treatment for delirium? So we have antipsychotic drugs. Okay, now you need to know this. There's treatments for. We're going to give you the treatments for all these. Treatments for delirium. And what is delirium? That's a lack of focus where our mind is impaired consciousness and we're not able to function and focus. We have antipsychotic drugs, and then we also have reassurances. Okay, people there to encourage us, to keep us going, to try to bring us back into this reality. And then the other one is presence of personal objects. And those personal objects do what? Okay, those personal objects bring back the associations that keep our mind focused on what we're doing. Okay, so that's a big thing. So delirium. Okay, if somebody is delirious, we might say they're out of their mind. They're not functioning. So what do we do? Well, there's certain drugs that we might give them, but there's also things that we can do. We can reassure them, and the people that are around us, whether it's family, friends, somebody that keeps us, oh yeah, I see them, and that keeps my association. Yes, I'm remembering that. I'm remembering that. So if it's in an older person, okay, someone being there, I mean, we just went to the nursing home, okay, we just went to the nursing home in Psychology 101, and we probably had some people with delirium there who just weren't really functioning. And so you might have visited with somebody, and the reassurance or a personal object, you might have gone up to talk, and the person might even be like, oh, I had a son or a daughter at your age, or they might even remember themselves at that age, and so you have some kind of connect with something in the brain that's association. You know, so much of psychology is whatever we think about, what do we associate it with, that starts the development of thought in our brain that connects everything along the basal ganglia. It connects all the memories, and so we bring out the long-term memories and the short-term memories, and we put everything together. Okay. So once again, what's the treatment for delirium? The treatment is antipsychotic drugs, reassurance, and presence of personal objects. So it's kind of interesting because pictures are a really good personal object, but it might also be, you know, a watch or just something that brings back some kind of memory. Okay, so delirium is the first. The next one is amnesia, okay? And they call it amnestic, amnesthetic disorder. So amnesthetic disorder, we turn into the word amnesia. But once again, what is amnesthetic disorder? Okay, it's a period of time where we have short-term memory loss without. Let me read it right out of your book here. It's a short-term memory loss, permanent short-term memory loss with without impairment of other cognitive functions. So so what it is. Let's make sure we have this. Okay, so it's a short-term memory loss without any other reason. In other words, there's something that happened. Now we might have hit our head or something. Okay, but amnesia means we have no memory. There's no connection to any past or any association. So somebody with amnesia is kind of neat because we've heard this term before, so it doesn't catch us off guard. Okay, but during amnesia, the thing we don't realize is not only do we have short-term memory, we have a disconnect in our brain, and we are unable to learn new information or recall previous information. So you have a period of time where the brain is making this synapses, and then and you're learning, and you have recall and all these different things. But then you don't have recall, and then you have impaired learning as well. You can't learn new things. Why is that? Because how do we learn new things? We learn them by association. We say, okay, well, if this is this, and we're like, okay, so we're thinking all the things. You know, how can you help a little kid get ready for preschool? You give them lots of experiences. They hold sand. They see grass. Everything they see, they put in their brain. So the more associations they have, the more they have to draw from. So amnesia is a lack of recall, lack of memory. So not only do we have short-term memory loss, we also cannot learn new material and we can't learn new activities. Okay. And because we don't have that association. Now, causes, okay, this is kind of interesting, all right? Head trauma is definitely listed as a cause. We could hit our head and become amnesic, okay? But then it could also be lasting effects of a drug even after the substance is no longer ingested. Now, once again, and I'm not going to go into the drug deal a lot. I started talking about a little bit about delirium, but it's incredible what we do to our human bodies. But there's a lot of drugs that can cause cognitive failures here, and cognitive disorders, and alcohol's a problem. And we say, well, I only use this drug or that drug. No, even marijuana can create some problems. So we just got to be careful that we're not putting stuff in there that's causing our body to have problems. So once again, and I'm not saying everything is a result of marijuana or even illegal drugs, but I'm just reading this right out of your book. Medical conditions such as head trauma can cause anesthetic disorder or amnesia, as well as lasting effects of drugs even after the substance is no longer ingested. What's the treatment for amnesia? Okay, prevention. Isn't that interesting? Okay, so we have no cure for amnesia. It says no long-term success is known for curing amnesia. Prevention of hitting your head. So what about somebody that has amnesia? It's amazing because we don't even understand how the brain makes those pathways. So we just keep trying to associate. What do we do with delirium? Personal objects, people we know. We just keep going until we make some type of pathway, some type of connection between our long-term memory and our short-term memory and the stimuli coming to us. So once again, there's no known treatment. We just try to make that connect between the pathway. We try to get that person something familiar. You see it all the time, and sometimes we see it in movies. Somebody has amnesia, will see somebody they know, and all of a sudden they'll have some type of association, and they'll begin to make that pathway that connects. So that's what we do for amnetic disorder or amnesia, is try to get some type of pathway going. Something that the person recognizes, something that associates them, because remember, they don't even usually know their name when they have amnesia. So, okay, so we've talked about two of the areas right now. We've talked about delirium and anesthetic disorder, and we're talking about cognitive disorders, and we'll come back and talk about dementia on the next video.